head bumps, and concussion red flags, first aid for parents. So your kid just hit their head. Here's what to do and how to know when it's serious. Like and subscribe for more tips just like this. So first, you gotta stay calm. Most head bumps in kids look dramatic, but they're usually minor. If they didn't pass out and they're acting normal, chances are they're okay. But now it's your job to watch for any changes. Right away, you want to check for any other injuries. You want to use a cold compress for 10 to 15 minutes to bring down any swelling. And let them rest somewhere quiet, but don't leave them alone just yet. Why quiet rest, you ask? Because activity can mask symptoms, and quiet lets you spot red flags like confusion, dizziness, or drowsiness way more easily. Now, here's when to take them in or call 911. If they're vomiting more than once, they can't walk straight, slurring words, or just kind of acting off, any seizures, or if they have uneven pupils or weakness in the face, arms, or legs, and any loss of consciousness, even if it's just for a few seconds. Now, for infants, look out for a bulging soft spot on the top or any nonstop high-pitched crying. Why do these even matter? Well, because repeated vomiting, it's not about the stomach, it's brain irritation, all right? And slurred speech, weakness, or uneven pupils could mean pressure from bleeding inside the skull. And look, babies can't tell you what's wrong, so their symptoms show up in crying or head swelling. Let's talk about pain. For pain, use Tylenol. Avoid ibuprofen in the first 24 hours because it can worsen hidden bleeding by thinning the blood. Now, can they sleep? Yes, but here's the rule. You want to check on them every few hours. If they're hard to wake or arouse or seem off when they do wake, get help immediately. Why? Because symptoms from brain injuries don't always show up right away. Delayed signs matter, and it happens often. That's what I've seen in practice. Here's the bottom line. You don't need to run to the ER for every bump. You do need to watch like a hawk for the first 24 hours. And when in doubt, call your pediatrician or go right to the ER. That's what we're here for. Follow for more first aid tips every parent should know. Dr. Merchant out.